downward trend, and so you feel like, oh my gosh, gravity is just pulling me harder and harder, it's getting bigger and bigger. But what's actually happening is that we are losing that structural support in our faces. We're losing it everywhere in our body. But what is structural support? So it's bone, it's muscle, it's fat. These are the things that are keeping us up. So when we lose these, when our bone gets, smaller, when we lose weight or we lose fat, just we look different. And what are the things that you guys notice on your faces as you're aging?
Sagging.
There's always like
Loss of moisture.
three big things that I would say that my patients come in complaining of. One is nasolabial folds. The other one is marionettes. And the third one is jowls. I would say these three things are the biggest complaints. These three things are all related to changes really actually up here. So if you look at my face when I do that, all those things get better when I do this, right? So almost everything we're talking about tonight is going to be addressing that actually. It's indirectly addressing these symptoms by building up your structural support here, or lifting from here, which is our other new way that we're doing this. All right, so the things we're talking about tonight: L-therapy, sculptural radius, PDO threads, temple lift, and wrestling contour. PDO threads and temple lift are two very new things that a lot of you have kind of heard little bits and pieces about, but you don't really know about. Some of the other things I think a lot of you have kind of heard a lot over and over, but it's always good for a good refresh. So I feel like most people want these things, and younger people want the cheeks. So they not necessarily are, I think maybe in their 30s, they're starting to see those aging changes. They're starting to see nasolabial folds and marionettes too. But sometimes they're starting to see that maybe they've had a flat cheek, and they want, everybody who's younger wants to have that perfect heart-shaped face. So they want that nice jawline, those nice cheeks that kind of, just model like cheeks. So this addresses what they're looking for too. So I'm going to have you go to the next one. And actually the other way, sorry. Going backwards. Can you go the other way?
I'm trying.
Oh, okay. I bet you're in your yeah. Not that there's anything exciting on here. I made this very easy. So the first thing is L-therapy. And Diana has been showing you the machine. We've been talking about how we can really lift the tissues. So by being specific and going to your SMAS, which is that layer that the surgeon goes to give you a facelift, we can put energy in there. That energy is going to stimulate your collagen, and it's going to give you lifting over time. So all therapy is neat because it's a machine. It's not injectables. It's non-invasive. It does take time to see. There's no downtime though with it. So it's a great thing to do, and I would say that I would look at everybody in this room, and I think everybody in this room would benefit from all therapy. And even at 30-year-old or 40-year-old, if they start early, they're going to get that lifting. They're stimulating that collagen early on, and then they may not need injectables for a longer period of time. So does it replace injectables? Not necessarily, but it gives you a very nice supportive base that's going to help you to change. It's gonna help you to either need less filler or have a more natural look, give you that supportive lift. So even patients who've had a facelift, they're still coming in here for fillers, they're still coming in here for tweaks, they still need Botox. So, some people say, well, for all this money you should get a facelift, which I say, yeah, that's fine, get a facelift. It's kind of like getting the L-therapy where you're getting that structural support. But then you have to add volume if you need volume, and you have to do certain other things. So when you lift with L-therapy, you will see improvement of jowls, which I said is one of those symptoms. It will sometimes make you look like you had filler, because I call it we're doing like fat pad relocation. So because of that loss of structural support, some of our fat pads fall down, and that's what makes these things like jowls and nasolabial. So when we're lifting, it's relocating, and you'll actually feel fuller in your cheeks. Any questions about alt therapy? So now you've seen the machine, kind of know what it's like. The one thing I will tell you about alt therapy though, it is uncomfortable. And we do, with every alt therapy treatment, we use the laughing gas, the nitrous. So it really helps with that discomfort. And it's a one-time deal, and then it lasts for 2 to 3 years.
So how long does it take? How long is the procedure
The
last?
area is then around, she can give you the exact specifics, because it depends on how much you're, so for lifting the face, like low face is basically from here to here, and I think it takes about 45 minutes. If somebody's doing their full face, it's from here to here. Diana, about how long does it take for all therapy?
That really is gonna be dependent upon the areas that I'm doing and also somebody's comfort level. Because if somebody's uncomfortable, I won't keep powering through it. I'll switch back and forth and make sure you are comfortable. Probably for maybe a full face and a neck, I usually like about 2 hours put aside.
So mostly tonight we're talking about low face. Well, low face is what, about 45 minutes?
Yeah,
Okay.
about 45.
And then full face, what would you say?
Maybe about an hour, hour and a half.
Okay.
Some people find it not that bad at all and pretty comfortable. Then I can go faster because then I don't have to worry about keep going over the same area. But it doesn't matter to me. I don't mind making it more comfortable.
Yeah, there's always tricks to make it more comfortable, the laughing gas, and like she said, going back and forth, but not everybody finds it painful. I've had some of my wimpiest patients go in there and they walk out, they're like, what are you talking about? That was fine. So, it's not like it's painful for everybody, but I tell everybody it's uncomfortable because I feel like it's better to, than to tell them it's easy, and then they come out and they go, what are you talking about? I'd rather have them say, you know what, that was easy.
The lady on the screen, was that one treatment?
Yeah, yeah, so.
And the same day, the pictures taken?
No, so the results, thank you, so the
Okay.
results take about 3 to 6 months, and what I used to find, because when I first started doing that, I saw everybody back at a month, and so I would see like in a month, I'd already start to see some changes in people, and they'd even look like they had filler put in. You would see things, some people right away, some people it took a little more time, and some people like even at 6 months, I know I'm gonna spill this. Some people even at 6 months, they see results, but they're subtle, and the thing is that when you get something like alt therapy, these results are happening slowly, so it's really important that you come in for your 3-month and your 6-month follow-up. That way you can look at the pictures to see that there really are changes. They're slow and they're natural. So sometimes people come in and say, I don't really see much, but then we look at their picture like, really? Okay, well, look at this. And they're like, oh my God, yeah, I see it. Because these things make you look, I would say most of what we do make you look like you used to do, say 5 years ago, 10 years ago. So sometimes there are changes that you don't remember that you looked 5 or 10 years older ever. People even in half-hour treatment, sometimes they don't. It's just, then I show the picture like, oh my gosh, yeah, you're right, So I would say my patients, and I've been doing this for 20 years, so I would say that my patients all look younger than they used to when they first started seeing me. And some of them it's been 20 years ago, and some have been like 5 years ago, but even my patients being seeing me for 20 years, they look younger than they did 20 years ago. So it's aging in reverse.
So I have a question, just how long it would last? And
2
who
to 3
decides?
years.
Oh, 2 to 3 years,
So
depending on your genetics or how
depending on how well you respond, how well you take care of yourself.
Yeah.
So you do alt therapy, you're using retin-A, you're staying out of the sun, you're eating healthy, you're not smoking. All those things go into it. Your genetics, it's gonna last like 3 years. And it's not like, at 3 years it's gone. It's just that you're going to continue to age, but the changes you're seeing are lasting for that amount of time. If you decide that you love your results and you want to, stay on top of things, you could choose to do this once a year, or you could choose to do it once every 6 months. Christy Brinkley used to be the spokesperson for alt therapy, and she always said, I don't really get anything else done, which I don't believe. I know she's had some surgery, she's had some filler, but she does do the alt therapy like every 6 months, you know, people who can afford it and, you know, they do it every 6 months, and what happens then, it's not going away back to where it was, you're just, you know, building and building and building, so you're just gonna continue to get better at that. So, nice treatment, single treatment, lasts 2 to 3 years, very natural, great for people who don't like injectables. Downtime is minimal. Some people will bruise, but it's pretty rare. So I would call it a no downtime procedure. The downtime that you get from it is usually going to be swelling, which I like. I mean, that swelling makes you feel a little tighter. It's good downtime. Now, sometimes people bruise real badly, and then they have, you know, not very bad downtime, but it's very rare. All right. So, any other questions? So we're gonna talk about Sculptra. This is a patient of mine, older patient, and it's not really showing everything. We're looking at one side of her face, I put Sculptra in, and the other side, it shrunk it up. But basically, you can see on the one side, she has volume, and the other side, she doesn't. This is a patient that I've done Sculptra in. She has some nice volume coming back. And you can see like some of her lines are decreased, and let me know, just, you can, is this the last Sculptra picture?
No.
I think there's more.
Yeah.
You can see like her nasolabial folds are lifted up, and she's a very thin face, so she needed some global volume. So Sculptra's all about global volume. Sculptra is a product that is put in, it's liquid, and you have some up here. It's in a vial. It's little particles of ground up almost PLLA, which is like what resorbable sutures are made of. And then we mix it with sterile water, we mix it with lidocaine, and put it in a syringe, and it's like this, and it's injected into your face. And it's a global injection, so usually I'm injecting the temples, I'm injecting into the cheek area, which helps the under eye area. I inject up into the hairline. I inject the front of the ear, and a little bit in the jawline. And sometimes, depending if people need it, they probably in their cheeks, some in their cheeks. So I use a cannula, which happened to the orange one, but the cannula, I think Sculptra had these out. Skylar had these on the tray, but these are like needles, but they're dull at the tip. So I'll go in through one point and literally fan the product out. And so it's a pretty comfortable procedure to have done. Usually there's not much bruising. What happens is when you have it, like that patient, we were kind of going around and you really couldn't see it. When you have it, you immediately get volume back in your face. However, it's called the Cinderella effect. So most of what's in there is the sterile water and the lidocaine we mix it with. So what happens is as that gets resorbed into your tissues, it goes away. So within 48 hours, you're going to wake up and look just like you did when you came in. So people are like, oh my God, why would I do that? Because that Sculptra is going to stimulate your collagen. It's like putting seeds in the garden, and then your collagen's going to grow. So it's going to grow your collagen over 6 to 12 weeks, so 1.5 to 3 months. We usually do 2 vials, 8 weeks later 2 vials, and then once you pick up the mirror, you look at it, you go, perfect, love it. Then we go once a year with 1 vial once a year to maintain it. Okay, so it's a neat product. It's a very natural look. It's giving you more of a global rejuvenation, so temples out here. It just really gives you a nice revolumization and picks everything up in doing that. So, and it's long lasting. It does last for 2 to 3 years. Again, it's building your own collagen. You're going to continue to age, but you're going to have those results for 2 to 3 years. And I know that for a fact. I can't remember how long I've been doing Sculptra. I think at least 8 years that I've been using Sculptra, but I've had patients who listen and they come back once a year for their maintenance, and we just maintain them right where they are from the point where they had those 2 and 2 vials. Then I have some patients who, you know, they get busy and they skip a year, so they come back 2 years later, And sometimes we have to, you know, do 2 vials to get them back up where they were. And then I have some patients go 3 or more years, and I have found at 3+ years, they've really gone back to what they were, and we kind of have to start over, you know, which is sad because 2 vials, that's a lot of money. And then they could have just spent at 1 vial once a year to maintain, but you know, life happens, things happen. So it is a product that is 100% relying on your body building collagen. And I have like that one patient, she was 79 or 80, and they're building collagen, they're still building collagen, she's getting a great result. And then I've had some 40-year-olds that didn't build collagen super well. So it just depends on your body's ability to do that, which again is related to healthy living and diet and genetics and all that. So beautiful product, also makes your skin glow a little bit. If people have real crepey, wrinkly skin, it really helps that as well. You can combine it with something like Radius, which we're going to talk about in a little bit, where sculpture, you kind of have to plan for it. So if you come in here and you say I have a wedding in a month or 2, that's probably not going to be my first choice because it takes 2 to 4 months to see your results. So I would probably pick something a little more immediate. So, but let's say you're on what I call the sculpture train, and you've used it and you're maintaining it, but you have an event coming up and you say, I want a little pick-me-up with my cheeks. We can pop a little Radius in there to pick you up, give it a little immediate pickup. So these things are interchangeable. So any questions about sculpture?
So you said that probably you would use 2 injections and then 6 months later?
2
more?
2 vials.
2 vials.
Yeah, which is this, and then 8 weeks later, 2 more vials.
Okay.
So you do one, and then 2 months later, you do another one. And let's say somebody's going away for the summer and they won't be back for 3 months, that's fine. You know, it's a little bit of leeway. I just don't like to do them sooner than 2 months apart. So it's a neat product. You know, people come in and ask me, like, we're going to go through all these things, and then you're going to say, well, what's the best one for me? And it just really depends on what your needs are. Do you have an immediate need? Do you want something a little more natural? You want something that builds your collagen? You know, just it's always a conversation that we have together. You know, what's your budget? You know, it's those kind of things. Some people don't like injectables. Some people want injectables. It's just, these are just all the different ways we can take care of these problems. All right, so Radius. How many people in here know about Radius? The whole room's gonna raise their hands. Radius I've been doing, I would say probably for like 18 years before it was FDA approved. That's this one. Calcium hydroxyapatite. It's white. It's something that's naturally occurring in your body, but this is a synthetic. So it is a product that is inflammatory. It's considered in the same group as Sculptra. So Sculptra is called a biostimulatory filler. Radius is also a biostimulatory filler. And this is our Kieran, who's our permanent makeup person. Do you mind, for these kind of slides, do you mind if I go kind of one by one after I talk a little bit? I'll let you know just so I can kind of talk about where I put it and everything. Both are biostimulatory fillers. This one takes time and lasts 2 to 3 years. This one is immediate and lasts about 9 to 12 months. So both are going to build your collagen, but this one gives you an immediate too. So that's the biggest difference with these two. So this is the one you're going to get if you come in here and tell me you have a wedding to go to in a month, 2 months, that you're going to get Radius because it's going to immediately lift you. Radius I do on your bone, follow your anatomy. We do really nice structural lift. Everybody who does this in the mirror is a great candidate for Radius because I'm putting the product exactly there and you're going to get that exact little lift. So it's perfect. We do a lot of things with Radius. Sometimes I'll dilute it a little bit and use it like a sculpture where I go in with a cannula and kind of fan it around to smooth things out. Sometimes we do it in the neck and arms, legs. I mean, we can put it everywhere, the butt. So we use Radius a lot. for those areas, but it is the only filler out there that stimulates your collagen, okay, and gives you an immediate result. So just kind of keep that in mind. Okay, so this is Karen. She has done radius in the past. We did a little bit of what we call liquid lift. I put product here. She has a very full face, and a lot of times people who have a full face get nervous about putting filler in their face, but this shows you how does her face look. Does it look fatter or fuller here? You think it looks fuller in this one here? Yeah, I feel like it's fuller, but not, like, see, she was heavy and full down at the bottom, and it's really taken the fullness up here, and I actually feel like it, when it's a full face, it kind of streamlines it a little more, makes them look almost a little thinner. It's fuller with volume, but in the right places, kind of streamlined and thins it up instead of feeling full. Because the fullness in somebody with a full face, their fullness falls here too, and then they feel heavy down here. You can go to the next picture. So this is radius being done, and you can see a little bit of the product there going straight down onto bone, and which sounds horrible, but it's actually more comfortable than doing Botox because all your nerve endings are in the surface of your skin. So when you're doing Botox, I'm up high in the skin, and you're gonna feel it more. Whereas here, you don't really have nerve endings down deep, so it's actually a pretty comfortable procedure. Go to the next one. And this is a patient, again, had some radius in her cheeks to lift. And you can see Marionette's a little bit better. Lifted, and the big thing here is under the eyes. So a lot of people feel hollowed and drawn under their eyes, but a lot of times the first thing I ever do is put radius there to lift, and it helps it. And go to the next one. And that's another radius lift, and just giving her a nice structural support. Next one. And that's another radius in her cheeks to lift up. So again, it's kind of what you do in the mirror. Radius can be a little lumpy bumpy right afterwards, but within 48 hours, the swelling and the lumpy bumpy goes away, and you'll feel just like your tissue, and it'll look just like you used to look. A lot of these pictures are immediately after, so they still have a little bit of that swelling. Go to the next one. All right, so any questions about radius? No. So lifting PDO threads is new. I'll tell you, I've only done a few of them, but they're really neat. So we are using PDO threads, which is that sculpture material, that's what the thread is made out of. And it's a pretty hefty thread. It has barbs on it, but they're not like barbs like this. I mean, you can barely see them. They're like just teeny little barbs that grab into the tissue to hold it. This is in a cannula, so it is put in the tissue right in front of, like, so there's a lot of this procedure, the time it takes to do it is measuring and marking the face. So you can see there's like permanent marker on her face. There's a place where we just did the mid-face part of the lift. So we mark out certain structural points, and then the trick about this one, a lot of threads are being done this way. They're put in, and then they're used to kind of grab and pull up, but they're put more in the skin. These are actually put down into the subcutaneous tissue, which is like your fatty tissue, and it actually comes from this direction. So we reposition that fat pad here, then put the thread in, put it up to here, and secure it just by pushing down, pull it up and secure all the barbs in there, and then yank the thread up. It actually pulls it up, and that's kind of what's done there. It's like pulled tight, and then we snip off the end of the thread, push it, and the thread retracts up into here. So it is actually an instant lift. There's a little swelling because I used some lidocaine to numb it. Every patient I've done so far has said it's not hurt. It looks like it would hurt, but it doesn't hurt. Little swollen afterwards, but you're immediately lifted, and then this product is going to build your collagen. So it is going to stimulate collagen. Even though it's giving that physical lift, that suture is going to go away over the next 6 to 9 months. and that collagen's gonna be built. So the results of this lift last for 1 to 2 years. So, yeah.
What happens to, the strip? Does it just dissolve into your?
It dissolves. This is like a resorbable suture that when they stitch something up, that they tell you, don't worry, you don't have to get it taken out, it's gonna
Okay.
dissolve. That's what's gonna happen. So over 6 to 9 months, this is just converted into like a simple sugar dissolved into your body and it's gone, but in the meantime, it's stimulated some collagen that's hopefully gonna help pull that up for anywhere from a year to 2. So pretty neat. It's not for every person. I really have to look at your face, and especially now that it's like early time of me doing it, I'm really picky about what kind of faces I do. Really have to have a certain amount of a fat pad and a certain amount of fat up here, because the worst thing I want to happen is that you're gonna have a thread that's showing under your skin, because I couldn't get it deep. So, you know, if you're interested in this, just let me know and I'll evaluate your face and see if I think that you're a candidate for this. But it's a really neat procedure. So I lift up from here, and then I go from here and lift up over here. So it's really a nice full facelift. So when people come in and they're worried about their neck, instead of doing lifting threads in the neck, I'm really lifting here, and then in the neck we can do some collagen stimulating threads. So it's kind of exciting, and you know, as I do more, you're gonna hear more about it. But I'm thrilled when I do them. It's really exciting. You can go ahead. So this is her immediately after, and you can see the amount of lifting is pretty nice. And she is she's very full and heavy, like in the center of her face. So it's really just kind of relocated those fat pads back up. It's almost like we just tack them up. And this is the only thread company that does it from this direction. Most other threads are coming from here and they're just pulling the skin and they're putting a lot of tension on the thread. When you go from this way, you're tacking up and you're not putting as much, you're almost securing it as you go. So it's really, to me, I'm big into the science, and I think the science of this is amazing. Go ahead. And for those of you at home, our secret code, I don't want to forget, so our secret code tonight is LIFT. So if you want to get your 15% off on any of these procedures, you'll be calling tomorrow with that secret code of LIFT. And you guys, for tonight, you're set because you're here. You don't have to worry about it. So this is one side done, or actually no, this is both, sorry. And that's our marking that we've got on there. So I would say most of the procedure is doing the marking. Once I'm going to get that thread in there, it's pretty quick. Okay, go ahead. Another one. Before and afters. So any questions about the thread lift? Alright, then we've got our other exciting thing that I've been doing since February, and this one is really cool. I want everybody to reach up to their temples, like kind of a little knot in front, but go back into your hairline. And then pull up and look at your neighbor and ask them if that does anything for you. Is that lifting everybody? Okay, so that's what I'm doing with the temple lift. So it's really cool. You can go to the next slide. This is an awesome procedure because it is instant. It has no downtime. Like really, if you have a wedding the next day, I'd say let's do it. No problem. No downtime. And the results are, that's why I used wow, because it's like everybody who looks in the mirror like, wow. It's so hard to explain what the results are because it's very natural looking. It's subtle, but it's not. It's very beautiful. It just takes that tissue here and lifts almost that whole side of your face up.
How long
It's
does
really
it last?
pretty. It lasts, I think it's gonna last about 9 to 12 months because that's about, the filler that we use is Restylane Lift. So that's about how long Restylane Lift usually lasts. I have a feeling it might last a little bit longer because the place it's put in the hairline and it's right up here. it's not really a place where we have a lot of movement, so I feel like it might last a little bit longer, but because I started doing it in February, I don't have a for sure answer for you yet. The way it's done is with this cannula, which you can see is a little bit long, basically goes from here to that place in the hairline, and one little poke right in front of the ear. This cannula goes up, and then I put the product up here in the hairline. You will have a little blob of product there that you will be able to feel. I call it the little horns, and it will give you instant lift. So easy, painless. It's great for people who really want to look natural but want a nice lift. They don't like pain, they don't like downtime, and they like results. So it's perfect. Really, that's probably everybody, right? So, who wouldn't this be good for? If somebody who eats up Restylane kind of fillers, you know, it's probably not a great product for them. You know, like they do their lips and their lips are gone in a few months, or you know, they put Restylane around their mouth or in their cheeks and it's gone pretty quickly, then it's not a good product because the same thing would happen to them then. But I feel like everybody else, this is a great, it's great results. I mean, patients look in the mirror and they're like, wow. We go to the next one. And this is a nice result. And you can see how her cheek just flows up nicely, jawline's a little bit better. And there's really, you know, I mean, you see a little bulging of her veins up there because when you put that product, the veins up there get a little bit compressed immediately, but, you know, so they bulge out, but that goes away. And next slide. And again, it's you can see even her kind of indent that she had is better. Beautiful flow up here. And it's just, everybody looks in the mirror, they just say, wow, natural youthfulness. Up and go backwards. That was another one. I skipped.
You want me to go back?
That's okay. Because I don't want to keep everybody too long. So Restylane Contour is another product that's newer. It's a new Restylane, and the things about this one is it has lifting properties, but it integrates a little bit, just kind of like a Radius does. It's very soft, so it's very good, I feel, for lifting on somebody who does not have a lot of volume. Radius I like for that, but sometimes people who have like a real, what I call skin on bone, they feel like if they have filler here, it's too bulky and they're worried about that. It's very soft, natural filler. I think it's really great for young women. Like we've done it on a few young women. It just looked really soft and natural because they didn't really need a lot. And it's also a good one to, like if people feel like their cheekbone is kind of, they lost a little volume here or here, it's a nice way to contour the face. So Restylane, easy. We usually do it with a cannula or we do it on bone. And it gives you your immediate, beautiful results, and it's really pretty. So just another option out there. And I think that's everything. This is contour being done, and she was getting married in a couple weeks, so it's a nice one. And it, you know, there's always possibility of downtime and bruising, but you know, a lot of people who are really scared of looking. I think people, because there's so many people who are overdone, they get afraid that they're going to look unnatural. So contour is a very natural looking one. You can see just a nice little lift and really natural looking. I think that and temple lift, probably the most natural ways that you can lift your face. If you're afraid of that you're going to have too much or look overdone. I would say if you're coming to renew, that's not usually an issue because we tend to be pretty conservative, and I think we're known for being natural and nice result. That's it. Anybody have questions? Anybody confused? No. I tried to make it organized and simple. This, we need the sound. This is our laughing yes. This probably doesn't do sound, but. So this is just for me to remind you, if you're worried about any of the pain of this, We use the laughing gas and. So it makes everything painless, so you don't have to worry. We take really good care of you. We take very good care of you here, so you're gonna be fine. All right, you guys, thank you. We've got a little raffle, and I want to thank everybody for coming. It's great to have you. And we've got lots of food, lots of wine. Please imbibe and enjoy. And otherwise, all right, so we have 2 raffles tonight. We have skinker, and then we have an area of discord.
We have the other half.
Oh, I see. And next time those